I'm going to make a start on session one with our series of research presentations. So I'd like to first introduce, we've got a group presentation, so I'll introduce all the speakers in that group together. So we have Dr. Janine Nip, who is based in Wellington, New Zealand, and is a research fellow at the University of Otago and Aspire Aotearoa. Her main interests are public health and respiratory research. Over the last decade, her work has included the development, conduct, and publication of clinical trials, observational research, and clinical guidelines. More recently, her focus has shifted to public health research, including understanding the patterns of smoking and vaping in New Zealand and internationally, as well as the implications of government tobacco control and policies. And also we have Associate Professor Andrew Wah, who is a research fellow based at the Aotearoa Maori Health Research Centre, Department of Public Health at University of Otago. He's a co-director of Aspire Aotearoa and a trained social scientist with postgraduate degrees in public health. His work includes evaluations of community, national and government level policies, programs and services, and he has also lectured and developed aids for teaching evaluation methods. Andrew's public health interests include teaching I've forgotten again the pronunciation. Maori methods, and conducting Maori health research and conducting health research with Maori communities. He is involved with tobacco research, health promotion, evaluation, and international design and urban Maori wellbeing. And we also have Elshadan Tortolo, who is a professor in the School of Public Health at the Auckland University of Technology. His primary area of research focuses on the health and wellbeing of Pacific communities within Aotearoa New Zealand and the wider Pacific region. He's provided Pacific research expertise on numerous tobacco control projects, including the ITC New Zealand project and Whakaha Aotearoa Harakeke research program with the Aspire group at University of Otago. He has Samoan and Cook Islands heritage and is motivated by the opportunity to use his work to help and serve his specific communities. So I'll now like to invite the three presenters, starting with Janine, up to the podium. Thank you.
Kia ora koutou. Hello, everyone. It's a real privilege to be here over from Aotearoa, New Zealand. And at the moment, I'm going to speak on behalf of Dan and Anaru, and we'll get them up at the end for questions. So first of all, it's a real privilege to be here, and I come over with respect and acknowledgement of the traditional owners of the land, and I'm really pleased to be here. So today I'm going to be talking to you about desire to quit smoking and support for the smoke-free legislation in Aotearoa, New Zealand. And coming off the back of Coral and Jeff's talks, it's a little bit daunting, but it's also really good because Jeff has actually given you a really good background about the roles that the ITC project has. So this project that I'll be talking about specifically is the ITC project that's being conducted in Aotearoa, New Zealand. So I'll just move on to our slide here. So just to let you know that there's no conflicts of interest to declare here. I work through the University of Otago, as does Anaru, and Dan's from AUT, and we're working in conjunction with Jeff and his team over there in the University of Waterloo. So talking about the study, the EASE study has been running in New Zealand for a number of waves. The study that I'll be talking about is wave 4, which was conducted in 2022. We've got another wave coming up, hopefully that'll start up next week, and that'll be our wave 5. So what happens is we had adults over 18 years of age who smoked take part in the 2022 study. So these were people who were currently smoking and had smoked at least 100 cigarettes in their lifetime. In terms of recruitment was made through invitation of participants from the previous wave and also replenishment participants, and they were obtained through panel invitations as well as social media and other marketing. We aimed for recruitment of a third Māori participants, a third Pacific participants, and also to have a third of people between the ages of 18 to 24. And that was to allow explanatory power for subgroup analyses. The data I'll be presenting today has had the refused responses excluded, and it's been weighted to the New Zealand Health Survey, which means that we can adequately represent the people who smoke in Aotearoa New Zealand. And so the data I'll be presenting in all the graphs, they're all percentages, and the little error bars on them will be the 95% confidence intervals. So in terms of participants that were recruited to the study, over 1,000 people took part in the online survey. We had a range of ages involved and a range of ethnicities as well. We didn't quite reach a third for Pacific, unfortunately, and we're working really hard to try to increase Pacific recruitment for the next wave coming through. So in terms of these two boxes, if we start at the top here, we can see that a huge proportion of participants plan to quit smoking in the future, over 68%. And that around about 3/4 of participants reported regretting having started smoking in the first place. So this gives us a picture of people who are motivated to quit. They want to stop smoking and they regret having started in the first place. And that's great news. What's the less good news is the second box there. So over 80% of participants had tried to quit in the past. Over 40% had tried to quit in the previous year. And over 80% of participants said that they felt addicted to smoking. So we're really tying in this picture of people wanting to quit and just being unable to do so. So let's talk about the legislation measures in New Zealand. You've probably had it done to death, but just very briefly, they were repealed earlier this year. There were three key measures that were repealed. So the first was the mandate of very low nicotine cigarettes. So they would make cigarettes essentially not addictive. So very important to our study population and their reports of addiction there. The second was a massive retailer reduction. So we have around 6,000 retailers in Aotearoa. That would be reduced around to 600. And the smoke-free generation was the implementation of a law which would stop people selling to people who were born in 2009 or after. So what you can see here, I think the main thing to take away from this is the blue slices of the pie, and the fact that the blue slices of the pie in general were larger than the pink slices of the pie. So if we start off looking at VLNCs, there was 48% support and 32% opposition for this measure. If we move over to the smoke-free generation, support was even higher. Total support was around 59%. Opposition was around a third. Retail reduction was actually, the picture was actually a little bit flipped on that. So 40% supported and 54% opposed. And so the real take-home message there was that in general, there was more support than opposition, at least for the VLNCs and the smoke-free generation. Another interesting thing to point out, and this probably is in keeping with something that Jeff mentioned this morning, was that we had 20% of participants who said, don't know. I don't know whether I support it or I'm against it. And that might be the fact that the majority of the population haven't tried VLNCs or very low nicotine cigarettes before, so they don't actually know whether they support or don't. And I think that's a really important area of research to follow through on. So in terms of adjusted analyses, these are hot off the press. So by the time I'd submitted these slides, they weren't available, and now they are, so I can share that with you. So we did analyses looking at differences in support by ethnicity. So support by Pacific people was similar to non-Māori, non-Pacific. Support for Māori, from Māori, was slightly different. So again, we have that picture that the majority I should say a greater number were supporting very low nicotine cigarettes rather than opposing, and same for the smoke-free generation. And again, it was flipped. There was less support for retailer reduction. When you compare that to non-Māori, non-Pacific, support was slightly lower. So if you just look at the numbers here, sorry, I'll read them out as I didn't get to put them on the slide. So support for VLNCs from Māori was 40%, for non-Māori, non-Pacific it was 52%. For retailer reduction it was 34%, and for non-Māori, non-Pacific it was 42%. For smoke-free generation it was 52% for Māori and 64% for non-Māori, non-Pacific, so slightly lower there. We also looked at anticipated responses to VLNCs in a retailer reduction. So if we just have a look at this slide here, this is we basically asked people what they thought they would do if VLNCs were mandated. And just bear in mind here that this data is from 2022. So this is before the whole repeal and whatnot. It's going to be really interesting to compare to the data after the repeal collected this year. So at the top, you've got a proportion of people who don't know, they weren't sure. And then the next 3 bars represent people who thought that they would either stop smoking or cut down on smoking. So that represents those green bars represent around 30%. The ones below it were more along the lines of carry on like smoking like I do now. And those of you that saw my presentation yesterday talking about alternative sources or illicit sources of tobacco might be interested in the bar at 19.1%. So that was people who would carry on smoking as they do now, but find a way to get cigarettes or tobacco with higher levels of nicotine. So cigarettes that were illegal potentially in New Zealand. Looking at anticipated responses to a retailer reduction, again, if you want to look at those green bars as the most important take-home message there, around 40% of participants anticipate cutting down or stopping smoking. So overall, it really creates quite a strong picture that you've got a group of people who want to quit smoking, but due to their addiction are unable to quit smoking. And that's where the measures like the very low nicotine cigarettes come in, because these cigarettes are not addictive. So it works twofold, really. Not only would you be supporting people who want to quit, to stop smoking, you potentially would also be stopping people starting smoking in the first place because they're not addictive. They're not going to build up that pattern. However, as you're all aware, our measures were repealed earlier this year, despite that substantial support. And since then, there's been a lot of information coming in from the public and a lot of pushback from the public who do support these measures as well. The other take-home message really from the data is that while it's a minority, it's a substantial minority of people who smoke who anticipate that those measures would have led them to either stopping smoking or cutting down. And that's it for now. So maybe Anaru and Dan, did you want to come up and see if there's any questions?
Any questions from the audience about the presentation?
Thank you, Janine, for a wonderful presentation. I was wondering if you have analyzed or are planning to analyze the relationship between the support among people and their anticipated responses. Because what I found from the ITC Korean survey is that people tend to support the policy that wouldn't really affect them. So people using non-cigarette products support the ban on cigarette sales. And I think analyzing such relationship would enable us to anticipate the actual response of the people if the policy was to be implemented.
Yeah, I think that's a really important point. What we have analysed to date was, although I just presented data for people who smoke, I've also got data from people who had quit smoking, and that did show stronger support for all 3 measures. So it is indicative of people who are not smoking or not directly being, impacted by those measures having a bit more support. And again, we're seeing that with the new smoke-free generation as well. That had much more support than others. One thing that we haven't looked at and we could look at is sort of intent to quit. So we've got that information as well. So it'd be interesting to look at that. And yeah. Oh, actually, the other thing is that we do have data by whether a person smokes daily or less than daily. And not surprisingly, the less than daily smokers were a bit more supportive of all 3 measures compared to the people who smoke daily.
Questions?
Do you have any data on the relationship between people's acceptance, but particularly for the very low nicotine solution and their experience of using vaping products?
So that's people who vape, what their opinions are.
Current vapers or ex-vapers in relation to their support for VLNC.
Yeah, we haven't looked at that, but we should. One thing that I should say is we incorporated in the question on VLNCs, it was if alternative products were available, would you support the implementation? But yeah, that'd be really interesting to look at.
Were there any other questions? Oh, here.
Thanks, Janine. I'm really interested in this, the role of homegrown tobacco in New Zealand. So it's my understanding that it's legal to grow homegrown tobacco up to 5 kilograms?
Mhm.
So this is probably more of a policy question, but how much do you think that the availability of that will undermine things like very low nicotine products?
Yeah, I
it was
think-
about 7% said they would switch to it.
Yeah, that's right. If we go back to that one here, so we had, yeah, you're right. It was around 7% said they'd carry on smoking like they do now, but with homegrown tobacco. So that's something that we'd have to keep an eye on. And I would suspect, obviously, you'd have a market where people are using homegrown tobacco and that's got that higher nicotine content, and you obviously can't regulate people to only grow low nicotine tobacco. So yeah, that would be something we'd have to definitely keep a close eye on. I should mention that while it's legal to grow it in New Zealand, it's illegal to sell it. Yeah, so if you sold it to your neighbour, for example, that would technically be illegal. How you'd enforce that is a whole other question, though. Yeah.
I have a question about the comparison with how these percentages fit with the trial data. So in terms of the quit rates in trial data and the percentage saying that they would plan to quit, and the level of cheating that we see in clinical trials, and then also the level that are saying that they would go and get an illicit source or something like that. Have you done anything like that?
We haven't, and that would be really interesting, because I think one of the magic of introducing VLNCs is there's no opportunity for cheating except for illicit, obviously. So if you introduce that nationwide, that's really different to the trial setting where potentially you're providing people with VLNCs and then they're like, oh, this isn't doing what I want it to do, and popping down to the dairy. There's nothing to stop them. Yeah, but no, we haven't compared it directly. Yeah.
Okay, if there are no more questions, then we'll move on to our next speaker.
Surprise, it's me. Should I just go, Cora? Is that okay?
We're going to do the three together and then come back to yours, but no, but you've got it the other way. That's fine. No, sorry about that. You can go ahead.
I see. I won't do the awkward introduction again, but I will just preface this by saying that this is a study also with no tobacco industry involvement. So I'm going to be broadening what I'm discussing now to talk about experiences from the first 6 countries to implement tobacco endgame goals. So this is the INSPIRED project, and for those of you who love acronyms, the acronym stands for the International Network to Share Insights on Tobacco Endgames. So this is something that I was really fortunate to come into. It actually started before I started research with this team, and I've been really lucky to be involved with that group listed there. So that's a group of people who have come from Canada, Finland, Ireland, Aotearoa New Zealand, Scotland, and Sweden. So the first countries to institute government-endorsed endgame goals. So the design of the study, it started around in 2018. Key informants were recruited from each country, and they were given a template asking questions about their experiences with endgame goals, what they perceived the barriers were to endgame goals, and whether they thought they'd reached their endgame goals. That template was distributed, and then information was gathered by the in-country teams and then brought back to the University of Otago, where it was all put together like a big puzzle. That went out in 2018, and we've recently put out some templates just last year to look at updates to that data. So that publication there on nicotine and tobacco research is basically an overview of findings up to 2018, and I'm just working on pulling together the findings up to this year. So endgame goals, when were they introduced? So Finland leads the pack. They introduced their endgame goal in 2010. Aotearoa followed behind in 2011. In 2013, Ireland and Scotland joined. In Sweden came shortly after that. And then in 2018, Canada introduced their endgame goal as well. So this is quite a big mishmash, sorry, of a slide. But if we just start from the top, talking about Finland first, when they introduced their goal in 2010, it was actually to reach less than 2% prevalence of smoking by 2040. However, by 2016, they ended up with the goal you've got there on screen. So 2030, they were aiming for less than 5% daily use of tobacco products. And interestingly, the only goal on the slide there, they also wanted nicotine products included in that goal. So we're talking about non-medicinal nicotine products there. Then if you just look at the other boxes here, you can see that magical 5% number coming up, either less than or equal to or less than 5% for countries. And the difference in the green colour there versus the orange is that some countries aimed for a daily smoking prevalence at around about 5%, and others made life harder for themselves and aimed for a current smoking prevalence of around about 5%. So somewhat arbitrarily, I've just focused on the daily smoking prevalence countries here. And I just wanted to give you a brief overview of sort of how smoking prevalence is tracking and how these countries are doing. So all of the countries in the Inspired project, when they introduced the Endgame measures, the smoking prevalence was coming down. And the smoking prevalence continued to come down once these goals were introduced. And what I've got on the screen there are around about the latest data, which is sort of around about 2021, 2022 of smoking prevalence, so daily smoking prevalence for these countries. So you can see that Finland's sitting at 11%, trying to get down to that 5%. Aotearoa is looking pretty good at 7%. And Sweden's looking pretty good at 6%, and they project that they're actually going to reach their target either this year or next year. Two things to caution you about with this slide. So the first thing to say is that although it's a good comparison across the slide, I'd caution you against comparing, say, the 11 and the 7 and the 6 to each other, because this data was collected in different ways and for different age groups between each country. The second thing I'd caution you about, so for example, in Aotearoa New Zealand, oh yay, we're almost at our 5%, awesome. However, that's not indicative of the inequities that are going on in Aotearoa at the moment. So we've got smoking rates for Māori at easily double that. We've got huge issues with socioeconomic differences as well. So that sort of oval there is really hiding a lot of the story. When we look at the countries who set a current smoking prevalence, you can see here they've got a wee bit of work to do, particularly Ireland sitting there at 18%, Scotland sitting around 15%, Canada's doing pretty good at 11%. So I could talk about this for a really long time, but I'm not going to. All I want to do is give you an overview of the sort of key 4 lessons that were learnt from this study. So the first one, and I think we're probably all familiar with this, having talked about it at the symposium as well, is policy measures and having political support to enact them. So most of those countries had really strong power or empower, depending on whether you're deaf or not, policies in place at the time that their goals were implemented. And a lot of them went over and above the empower or power policies. So Canada's a good example with that, having their messaging on their sticks. New Zealand attempted to go over and above with those, those laws about the VLNCs, the retailer reduction and the smoke-free generation. We didn't quite get there. And we're hoping that Scotland and the rest of the UK will get there with it, at least with their age-based policies that are coming in. The other thing to talk about is the adoption of alternative nicotine products. And I know it's a very controversial area. The idea being, the theory being that these products create less harm and may be used as an alternative product to smoking and therefore may increase quit attempts or moving away from smoking. That might be by switching to the alternative product or quitting nicotine entirely. So just to give you examples of 2 very different views here. So Finland has taken, as mentioned, that really strong approach to, no, we don't want anything to do with nicotine and we want our prevalence down to 5%. Aotearoa, that it is a mixed picture of perspectives, but if you just take the Ministry of Health messaging, vaping to quit smoking is one of their strategies. And if you look at our vaping and smoking prevalences, you'll see that actually smoking is less common than vaping now in Aotearoa. Of importance and of difference, obviously, to Australia, you can walk down the road and pick up vapes at your local service station, at your dairies, at your supermarkets. I should mention that although there looks like a downward trend in smoking and an upward trend in vaping, that doesn't necessarily mean that the two are correlated, and I don't think we should infer that increases in vaping are necessarily directly linked to those drops in smoking as well, and that's an area of further research. Lesson 3, really important lesson. So despite the fact that all of the goals had, or either the goal or the associated strategy had mention of reducing inequities, and yet when I tried to pull up some papers on inequities just to show you, I could have filled 20 slides with these. There's just inequities in each of those countries, and they're persisting inequities. So somewhere in the line there, just saying that addressing inequities is not enough. Something else needs to be happening. Something else needs to be happening quick. In terms of perceived barriers to progress, so we did ask participants about what they thought might impact on them achieving their endgame goals. So lack of funding, lack of capacity, lack of resources, lack of endgame measures to rapidly slow that progress, and also address inequities, because if you're bringing in a measure, for example, like VLNCs, where you've got sort of a blanket approach that's going to affect everyone, as opposed to, say, having individual stop smoking services where certain groups may not have access. And then the last point that I just wanted to make was tobacco industry influence and actions. As has been mentioned before, there's something really important to focus on. In that picture there, that Save this Dairy, this was my local dairy. It's 5 minutes walk from my house. And they had the sign out when the smoke-free legislation was coming through. So, you know, me being curious, clicked on it, scanned the QR code, and essentially it was a petition to save our stores. So they were saying that the retailer reduction was going to cause huge problems across New Zealand. It was going to disrupt business. It was going to give power to the gangs. What were they also? They say, oh, illicit trade was going to go up, and you're taking power away from New Zealand dairy owners. Interestingly, the person who fronted this campaign was apparently a local dairy owner, and he was encouraging the other dairies to take part in this. And when you scroll down to the bottom of the website, in itty bitty teeny tiny writing, it had that the website was created by British Tobacco and Imperial. And then when the media caught on to this, they tried to find the person who was the local person who was in charge of sort of running this group, and suddenly his picture disappeared from the website and they couldn't get a quote. So interesting story there. So just to wrap it up, key experiences or key messages from other countries with endgame goals may provide guidance from other countries. And you've already had examples about that. For example, Jeff has mentioned about the plain packaging in Australia, and that being distributed around the world is an idea to follow. It is important to consider, though, how to reduce socioeconomic and ethnicity-based disparities, how to mitigate potential barriers, including interference from the tobacco industry, and whether endgame measures, as you know, punching above that business as usual to really get those smoking prevalence rates down, how they might be used and how they could be implemented. And the last point to make was there was a lot of difference in approaches and opinions from the different countries, particularly around this concept of, you know, banning nicotine products or using them as harm reduction. So it does suggest that diverse approaches to endgame goals are possibly the way to go and may be appropriate for each country. And that's me.
For Janine on that second presentation.
Janine, do you think it's feasible to separate out endgame strategies to address our disadvantaged populations, to try and morph our strategies to try and reduce that inequity between between those populations?
Yeah, I think it depends on the strategy. So for example, if you're talking about, let me have a think. So if for example, if you're talking about raising tobacco prices, say that's your endgame strategy, you're raising it so that it's just impossible to purchase tobacco unless you're spending, you know, megabucks on it. That could arguably be an endgame strategy. But potentially you're going to disadvantage people with financial hardship in doing so. So I think we have to be really careful about saying, you know, it's a blanket one size fits all. if you have the example of something that's a bit broader, like, you know, the smoke-free generation, for example, that's going to apply to all population groups. But then you could potentially be talking about inequities now by age, because you've suddenly got a group that's going to come through, you know, as a smoke-free generation, but you're not addressing the fact that the older people are still smoking. So I think it's important to consider sort of the context for the country and also the nature of the endgame goal itself. Yeah.
Okay,